Hey guys, so today we're going to talk about a subject that bothers loads and loads of patients, and that is a double chin, or excess fat under the chin, or submental fat, or it's got lots of different names, but essentially a little bit of fat under the chin, which can either be stubborn fat that's difficult to remove, or it can be more of a long-standing issue that someone's had for a long period of time. And I think there are a lot of misconceptions about this area and the best ways to treat it, and I'm going to outline a few different ways to think about it that might help inform you on what the best option might be for you. So on one hand, if you've got a patient who's, let's say, 35 plus or in their late 30s, early 40s, and they're first starting to notice a little bit of heaviness in their lower third of their face, and that can be compounded with a little bit of fat under the chin, often our approach is going to be to restore volume higher up, because the aging process starts from 25 onwards, and the best way to think about it is there's always going to be a downwards descent that's going to happen, but if we constantly restore and just replenish what's being lost higher up in the face, it tightens the lower third of the face to keep things looking as they were. So that's not going to be the perfect solution for lots of people, but it's going to start to maybe reduce a little bit of heaviness from the lower third, and is often a good option. Next, we've got the option of medical devices. So some of you may know we have the Morpheus 8 device here, which is a radiofrequency microneedling device, which actually does two things for the lower third of the face, because on the one hand, it directly targets the fat cells using heat therapy essentially to break down and reduce the size of the fat cells. But the other benefit of Morpheus is, along with reducing the amount of fat that you can see under the chin, it also actually works to tighten the skin, and particularly when you're looking at the neck, the jawline, from the cheeks down right to the neck, it tightens up that entire area, including the skin and including reducing the fat just under the chin. So these are often going to be fairly good options, but there's a third option which is also very popular, and that is actually to use fat dissolving injections. And these typically use a synthetic form of deoxycholic acid, which is quite a strong acid that induces the fat cells in a localized area to just break down. So the most famously known formulation of this within the UK is going to be something like Aqualix, which people have used for many years, including ourselves. And Aqualix is quite effective in that it's a very safe dose of deoxycholic acid. There's not many cases of compared to other formulations, at least, there aren't that many cases of severe complications happening, which is good. The negative with a treatment like Aqualix is it takes a long time. We're talking about 6 months or so. We're talking about repeat regular sessions, and the downtime between each session can be quite difficult, especially compared to some of the other options such as Morpheus. Having said that, part of the reason for this video today is we've actually got some exciting news, and after many years of patients asking me about a certain treatment that's offered in America, that I think Kim Kardashian probably made quite famous, loads of people have been asking me about a different formulation of deoxycholic acid. In America it's known as Kybella, and for this country its equivalent formulation has just been cleared, and it's just been announced that this is something that is licensed for use within the UK for under the chin. So we now have a new option that's a little bit more powerful and a bit more significant in its impact of targeting the fat cells under the chin using deoxycholic acid. What that means to a patient is the amount of sessions will be reduced, the speed of the treatment from start to finish will be a lot quicker. Now we're talking more about 2 to 3 months rather than maybe 4 to 6 months previously, and that process therefore makes it a little bit of an easier treatment for patients to tolerate. So talking specifically about this form of deoxycholic acid and fat reducing injections, I'm just going to go into a little bit more detail about this now. So the way that deoxycholic acid works is it actually works directly on the cell wall of the fat cells to break down the fat cells. So usually what happens is, straight after having these fat reducing injections, over the next 2 to 6 minutes or so, there's almost a little bit of a burny sensation where you can feel something is going on. It's not super painful, but it feels a little bit strange for sure. And that's the process of the actual fat cells starting to break down. Then, after that process, it calms down a little bit, and over the next couple of weeks, you've got the actual swelling process, which makes it a difficult treatment to get, because straight after the treatment, you're talking about a time frame of anywhere from almost 1 to even up to 4 to 5 weeks or so. The under chin area can swell up and it looks a bit worse before it looks better. Essentially what this is it's your body sending all of its kind of healing components to try and remove the debris of the fat cells that have broken down, and it clears up the entire area to hopefully leave a chin that's got less fat under the chin, and that's going to give you overall a slightly sharper jawline with a less noticeable double chin, which is often the primary reason why people get the treatment done. So as a treatment overall, it's very effective for doing that, and it's something that's going to last forever, which is good. When everyone says something's forever, it always makes me think maybe that's a bit too good to be true, and in this case it almost is as well, because with stubborn areas of fat, whilst we can reduce the fat and get rid of them, they are of course subject to lifestyle factors, and that means that you can obviously put fat back on, and it can also accumulate there later on in life. So like anything, if you get a treatment and it's successful, that's great, but it still means that you need to watch all the basic things like your lifestyle, your diet, your exercise, to make sure that it's not just going to pile back on afterwards, because then what's the point of doing the treatment in that case? Okay, so to wrap this up, I guess there are a few different options that best help cover the lower third of the face, including the jawline, submental fat, and tightening everything up. The best thing is always going to be to have a full consultation, but the purpose of this video is more so just to say that there is a new treatment now, which is FDA approved, and it's licensed for really targeting the under chin fat in a more aggressive way than we previously could, which is very exciting. So if anyone's got any more questions, then please do contact us directly, and we'll always be happy to help you. Thank you.